Awesome. Well, we can go ahead and get started. Hopefully some more students will be able to join. We invited everyone, if they have some time throughout the hour, to hop on for as much as they can. So thank you everyone again for joining us. My name's Alyssa. We also have Michelle and Dita here. We are all in the Career Services office, and we are excited to be joined today by Lyndon and Alejandra from the UC Davis Health. So excited. Thank you all for joining us, and I'll let you all take it from here.
All right, thank you. Well, we appreciate the opportunity to meet with all of you today and talk a little bit about career opportunities with us here at UC Davis Health. We can go ahead and go to our introductory slide. Great, so what we want to do today is just talk a little bit about potential healthcare careers with UC Davis Health. Obviously, we're one of the bigger employers in the area, and so for many of you, you might already have UC Davis Health on your radar, and if not, we're excited to tell you more about the organization and really just start to help you think about, you know, the different things that you're pursuing, the academic programs that you're a part of, and our hope is that you really start to see those opportunities with us, or just in healthcare in general, and that we can also provide you with a few tips or suggestions that you can take now to really help position yourself to be successful when it comes time to apply for those roles. On a personal note, I also want to share that I am a University of the Pacific alumni myself. I went there for my master's program a couple of years ago, we'll say. Really fantastic opportunity, and it's great to be able to stay connected to UOP. A lot of great programs there, and you know, we know the caliber of student that you are, and we'd love to have you join us someday, either at UC Davis Health or somewhere else too. All right, so we'll go ahead and we'll do more formal introductions. So I'm Lyndon. I am the manager of our Leadership Recruitment and Diversity Services office. So our team actually supports both UC Davis and UC Davis Health. And so what we do day to day is we actually oversee our executive level recruitments. So, you know, on the healthcare side, that would be those senior healthcare leaders, those individuals that are doing administrative leadership positions. And then we also do a lot of outreach. So we do job talks to students like you all. We go out into the community a lot and talk to people about career opportunities. And really what we hope to do is demystify the process and also provide you with insight about the kinds of opportunities that we have. You know, when you think about healthcare, you know, many people just think of doctors and nurses, and they don't really think about the many other opportunities that are available. The other thing that I'll share is that we're happy to be a regular resource for you all. And so, you know, at the end of this, we'll share our LinkedIn. You can connect with us there. You can reach out if you have questions, if you want to do some one-on-one conversations. We're always happy to be accessible and be a resource for you all. So with that, I'll pass it over to Ali.
Thank you, Lyndon. Yes, so my name is Alejandra Martinez, but I go by Ali. I'm the Diversity and Outreach Coordinator with Leadership Recruitment and Diversity Services. And so all of those outreach events and you know, recruitment activities that Lyndon had mentioned as being a part of the Leadership Recruitment and Diversities team, I help facilitate. I'm very excited to be here speaking with you all today, just to share some insight as to the different opportunities within our institution, and hopefully get you all excited about those, you know, career opportunities with us. So with that, I think we're going to jump into why UC Davis Health is an employer of choice. So we are one of the biggest employers in the region. We are also ranked as one of the best hospitals and children's hospitals in the nation. And with that comes a slew of recognition. So we're Magnet recognized, we're an LGBTQ healthcare equality leader, and we're also a verified center for children's surgery. There's, you know, there are a lot of recognitions that have come into you know, to UC Davis Health as a institution of healthcare, but that's mostly due to the staff and the workforce that makes up the healthcare system. Without the quality and caliber of staff that we have, we wouldn't be getting all of these recognitions. So it's exciting to be a part of that and to be able to contribute to that and to help others, you know, come on board and be a part of that as well. And then in addition to that, I know, I believe Lyndon was going to go over some of our DEI initiatives.
Yeah, absolutely. And the piece that I wanted to add too about UC Davis Health in particular, with the understanding that there are, lots of healthcare organizations in the region. I know there's Kaiser's out in Stockton. Like there's a lot of places that you could find your career. And one of the neat things about working for UC Davis and UC Davis Health is that it's an academic medical center. And so that might feel a bit like nuance, but what it really speaks to is the fact that as a public university, our mission and vision are very much driven around public health, reducing health disparities, investing in the community. And that's not to say that that's not also the case for other health organizations, but when you're a public institution and you're funded by the public and you're held accountable by your community and really by Sacramento and the state, it really does set our priorities in a way that speaks to our commitment to, being an economic engine and really contributing to the world beyond the four walls of the hospital in any way that we can. And so one way that that's operationalized is through our commitment to diversity, equity, and inclusion. And so we really do want to call that piece out as well, to the point that we have a team like ours that focuses specifically on, recruiting diverse talent to our organization. We understand that patients from underrepresented backgrounds or low income backgrounds do better when they interact with professionals and staff members that share similar identities to them or come from the same communities that they do. And so there's this very intentional effort to focus in on diversity, equity, and inclusion as part of this work. And so I want to share that with all of you as you're thinking about places that you, want to start your career and really thinking about that mission and vision driven approach to your careers. And then the other piece that I'll call out as well is that our hospital is located in a very urban community. And so as you think about opportunities to do internships, volunteering, thinking about the different patient populations that you would be interacting with, thinking about that too. Do you want to work in a more urban medical setting? Are you more interested in rural healthcare? Stockton is a, very similar city to Sacramento in many ways. And so as you think about how you gain experience and how to best prepare yourself to be successful when you go out and look for a job, just some of the things that you'll want to take under consideration. And then the last piece I'll share again is that this is just a point of pride for us. So you saw all those awards and accolades. Obviously you're here because you're interested in UC Davis Health, but this diversity piece is just as important to us. And we like to highlight that whenever we can. All right, so what we want to do now is just understand a little bit more about those of you that are on the call. I see a few of you included information about your majors. And so if you want to hop in the chat line really quick and just let us know, generally what kind of healthcare careers are you interested in? Is it more specialized? Do you want to be doctors? Some of you want to be x-ray techs? What is it that you're thinking about? And if it's more broad, that's perfectly okay as well. So we'll give you a second there to hop in the chat line if you can. All right, and if you're still thinking about it, oh, there we go, cardiologist. That's very specific, I like that. We'll make you a cardiologist, we'll make it happen. All right, we've got a doctor, fantastic. Okay, and if a few more you want to throw some suggestions into the chat line, happy to do that as well as we go through the rest of the presentation. All right, so what we wanted to do very, very briefly, because we want to get more into the specifics of what you're interested in, is just give you a little bit of information about how to find a job in general. So we know for the most part that none of you are job searching today, but we do want to give you a sense of, how you would go about finding those opportunities. And so, and much like any organization, you're generally going to find a general candidate gateway to go apply for those roles. And the main thing that I would recommend for you now, as you're thinking about career opportunities and the kinds of jobs that we have in healthcare, is actually to just spend a few minutes, it doesn't have to be now, it can be sometime down the road, but just actually get in there and see the kinds of jobs that organizations like UC Davis Health are recruiting for. It's one thing to have an idea in your mind about career opportunities. And it's another thing to really look at the industry that you're specifically interested in. If you want to be a cardiologist, take a look at a cardiologist job posting and understand more about the kinds of requirements that we have, the experience that we're looking for. You know, are there certain certifications or professional organizations that are being called out as of interest? So that still may be a ways down the road, but it's a good way to help you narrow your focus and understand more about, you know, what are the current trends and the current needs in the industry that you're interested in. So for us, this is how you get there. You just go to our HR page and you can start searching by keywords, by location, just learning a bit more about those opportunities. All right, and when you're ready to apply, we also have a neat resource for that as well. Again, it's an opportunity for you to just familiarize yourself with the process of applying for a job. Some of you, have probably done that in other spaces. You may already have jobs or internships. And so just understanding, again, what would be expected of you, what an employer asks for, will help you be better advantaged when it's time to actually go to apply for those jobs. So we're not going to walk through all of that because we know none of you are looking for a position tomorrow necessarily, but just understanding, do employers require a resume or do they want a full CV? Are they asking for a cover letter? Are you finding that these kinds of jobs require letters of recommendation or license and certifications? Like, these are the kinds of things that you can be thinking about now to help prepare yourself, when it's time for graduation. If you're not going off to grad school, then you'll want to be equipped to be ready to jump at an opportunity when it presents itself. All right, so I think we're gonna pass it back to Allie.
All right, yes, thank you, Lyndon. So wanted to kind of circle back to the different pathways to healthcare careers, specifically available within the University of the Pacific, because the programs that you all are part of really do have a lot of opportunity to, for you to build upon and advance your career once you get to that stage. So here are just some examples of different programs with undergraduate and graduate that could be of great use in your career search down the line with UC Davis and UC Davis Health. I know that a lot of you are interested, based on the chat, in pursuing becoming a doctor, becoming a cardiologist, and all of that, and that's amazing. Biology obviously would be a great way to do that, but there's a lot of different opportunity outside of patient care as well. So if you're interested in behind the scenes work where it's maybe not focused on patient care, but essential to the work that UC Davis Health does in providing care for the community, there are, business administration, computer science and engineering, liberal arts degrees, health administration and leadership is a great one, as well as management and human resources. In graduate studies, if you're interested in becoming a physician assistant or pursuing, your master's in computer science, innovative education and health professions, all of these programs are very, they're very in line with the work that we do. And there's a lot of career opportunities that can open up to you should you pursue them. So there's definitely a pathway in the educational institution you're currently at for you to find your way to UC Davis Health when the time comes. So the types of career positions that relate to those graduate studies and those programs that I talked about in the last slide range from anything between analysts and animal care to student services, marketing, communications, HR, and IT. There's really something for everybody. As Lyndon likes to say, we have enough types of positions to run a small city within our institution. So it really is that diverse in terms of career opportunities. It really just depends on where your interest lies, and then having the tools and knowing the resources available to you to find those opportunities as they come up. So a few of the types of career positions at UC Davis Health that maybe are not directly correlated to that idea of like a doctor or specific to to like nursing or whatever individuals think about when they think about UC Davis Health are things like lift technicians. And that's more of an opportunity for individuals to get some more direct patient care experience, where you're working to, assist lifting patients and transporting them. We have clinical research coordinator positions, program administrators for different projects throughout the institution, research data managers, compliance officers and investigators, information system analysts. If you're interested in the world of IT, that field is constantly growing, and especially within healthcare institutions, there's a very intense need for that will just continue to grow as our services become more kind of web-based and as all of that grows. Project policy analysts, social workers, HR analysts, generalists, and managers. So many different opportunities across the board. So it really does just depend on your interests and depend on you kind of reaching that point in your on your path where you're ready and interested for opportunities. Once you know what you're looking for in terms of your career goals, you'll be able to find something at our institution.
Yeah, that's okay. I just want to jump in again really quick and talk a little bit more about, some other ways to think about this too. So, one way that we really try to explain these opportunities to folks as well is, we have information technology as an industry, and then we have information technology in healthcare, which is very much around, HIPAA, compliance, working with electronic medical records, cybersecurity. And when you think about, this list of industries, you think about human resources, you think about social work, you think about a policy analyst, these are jobs that exist in the world. And then there's a particular orientation for this work in healthcare. So this for me was really eye-opening when I learned more about UC Davis Health and just the variety and diversity of jobs that are available to us. It's understanding that, hey, I'm really into human resources. I don't know who would say that. Some people are. And there's a whole profession of human resources in healthcare that's very unique, that focuses specifically on things like working with nursing unions or recruiting in healthcare or looking at benefits for employees that are receiving medical care from a hospital. So there's just so much that is out there in the healthcare field. And we find for a lot of students too, one of the reasons that we highlight more entry-level roles as well is that these, maybe first jobs or jobs out of college may not necessarily be your dream job or where you want to be in 20 years, but they are a great way to get experience in healthcare. We have medical assistants, we have individuals who help in the burn unit who will help dress wounds, and that's an entry-level position. It's entry-level in healthcare, so certainly still requires a certain expertise, but those are the kinds of roles that we often find folks will take on as they get actual in-hospital healthcare experience that will then be a stepping stone to further or different opportunities down the road. So, if nothing else, we want a key takeaway here to be that there are just so many opportunities that you can think about if you do that research and you spend that time to really think about what that work could look like for you.
Yeah, and that opportunity for development as well, like as you enter those more entry-level positions, as Lyndon had mentioned, the focus on employee development within our institution is incredible as well. So you just have more and more opportunity to advance your career. Something of note that we wanted to mention are volunteer services within our institution. Although they have been on pause due to the COVID-19 pandemic, there is hope that this will become available to the public once more, so that they can benefit from volunteering, and that our patients can also benefit from these volunteer service programs as well. So just something that we want to inform you all of as you start to consider what opportunities may lay ahead for you, to provide more kind of impactful information on your resume, and to have something that can have a positive influence on the community as well. to take a look at our volunteer services website, because fingers crossed there will be changes made to it soon and we can have the program up and running again.
Yeah, it's a great way to network. It's a great way to just have some hospital experience on your resume, or if you just want to go help out. I mean, it's a great opportunity. My aunt actually used to use volunteer services in the NICU, and her whole job would be just to rock babies, and she loved that too. So there's also that wholesome approach as well. If you just want to give back to the community, we like to highlight those volunteer opportunities as well.
Exactly. All right.
All right, so I'm going to talk a little bit about cover letters, resumes, and standing out as an application or as an applicant. The perspective that I'm going to offer, obviously is you want to view it through the UC Davis Health lens, and I'll call that out in particular when we talk about things like screening and our process, because we are a public university, and because of that, we do have some pretty standardized approaches to healthcare. In the private sector, I think there's probably a bit more flexibility, I suppose, when they're considering candidates, is what I've gathered from talking to people who have applied to work in the private sector versus working in the public sector. But the insight and suggestions that we're going to provide you are also really meant to be universal. So again, thinking about some of the things that you can be doing now to help prepare you to land that first job, and also that dream job down the road. All right, so the first thing we want to talk about of all things is actually cover letters. It isn't necessarily something that you think of right away, but from our perspective as recruiters, these cover letters can make a huge difference in terms of standing out as an applicant. The way I like to think about it is, say you're applying for some position with UC Davis Health. Let's say 50 people apply, and of the 50, maybe 20 are qualified. Let's say you're one of the 20 qualified people. Well, as a hiring manager, I'm still not going to hire, I'm not going to interview 20 people. If I'm only trying to fill one role, I'm probably only going to interview 5 or 6 people. And I have to use some criteria to determine who it is that I want to interview, just from a time management standpoint and a capacity standpoint. These cover letters can make a huge difference. And I know they make a huge difference because I've talked to hiring managers about how they make those decisions. And they will often look at a cover letter as a way to really differentiate among qualified candidates. And so, many people will just submit a generic cover letter, dear hiring manager, I think you're great. I'm great, hire me. Okay, I know I'm great. I didn't need you to write that in the cover letter to tell me that. But if you take the time to really call out the specific opportunity, to talk about UC Davis Health's mission and vision, why it's so attractive to you, why this is the role that you want, why you're the best candidate for this role, that makes a huge difference. Somebody, it's just human nature. Like, people are going to feel, maybe flattered isn't the right word, but they're going to tell that you really want this job and you're not just throwing your resume out into the universe trying to find something that'll stick. And so it's a great opportunity to stand out, and too many people just don't really prioritize it. And I want to emphasize, at least from our perspective, that it can make a big difference for you as a candidate. And so, even thinking about what you're doing in college now, the internships that you're doing, the volunteering that you're doing, that is all part of your story. And your cover letter is where you get to tell that story. Your resume is what you've done, what your skills are. Your cover letter is your chance to say, this is who I am as a person. And then the other piece that we really want to emphasize is that it's a great opportunity to highlight, leadership experience, diversity experience. Are you part of a student organization? Have you done community service? I know UOP has a great community involvement program and some other opportunities to get out there. And so use that space to highlight that, to stand out as an applicant. And then this other piece down here about providing context. If you're applying for a job and you have relevant experience, but it's not exactly what we're looking for, you can also use your cover letter to address that. You can anticipate the questions somebody might have about your candidacy and say, okay, well, they might be a little unclear about how this is related to that. So let me use my cover letter to answer that question before they even ask it. So there's no doubt that I can do the work. And then we also call out gaps of employment. That's probably not terribly relevant to this group right now, but if you do take time off, or you've worked somewhere for a while down the road and then for any number of reasons you're not working for a while. You can also use your cover letter to address that if you think it's a concern. I wouldn't be too concerned about it, but we just want to call that piece out too. Again, if somebody's going to have a question about you as a candidate, let that cover letter answer it on the front end. All right. And then, so we also want to talk a little bit about your resume. So obviously your resume is the most important tool that you have to market yourself. Your resume should always be up to date, at least, I don't know, I don't want to say once a month, but at least a couple times a year, take a few minutes to get that thing up to date, to make sure it's accurate. If you've done things and then you're not doing them anymore, change the tense to the past tense. You just never know when an opportunity will present itself. And it could be an internship, it could be a job at UOP, it could be a scholarship. There's a lot of times when having an up-to-date resume is relevant, and what you don't want to be doing is scrambling and putting something out there that is not the best reflection of who you are. So keep it up to date. And then something that's really important to us, again, as a public university, is that when we look at people for jobs, for better or for worse, the first thing that we're going to do is look at your qualifications compared to that job. So that's one of those pieces that I want to be really transparent about in the public sector, is that, what I tell people is that the best applicant for a job at UC Davis Health is somebody who's probably doing that same job somewhere else. So that comes with experience, but it has a lot to do with, the importance of us being consistent, the diversity piece, being compliant. What we don't want to do is get in a situation where we're like, this person can kind of do it, but they're the son of a doctor, or they're, friends with the chancellor. So we're just going to look over some of these things that they're not qualified for and bring them on board. So make sure that your resume aligns with the job position to the degree that you can. And also emphasize things like how long you've done something, and what those skills and accomplishments that you have are and how they align with that role. And then another piece is that if a job requires a license or a degree, and many do in healthcare, that you make sure that you highlight that too. Again, you don't want to assume somebody knows about your experience when you apply for a job. Assume they know nothing, and that they're looking at that job posting to make that determination about your qualifications, because we don't know anything. And if we have 100 people that are applying for a job, you might say you're a university librarian and you're applying for a university librarian job, but I don't know that you've done the things that I need you to do in my librarian job. So you want to call that out wherever you can. And don't assume because you're doing something similar that we're going to know you're qualified. And so I covered a lot of this, but again, I think the thing about your resume is, generally I think simpler is better. If you're maybe applying for like a graphic arts job or a communications job, maybe you want to have some fancy stuff on there. But for me as a recruiter, I want to look at your resume and I want to know what your education is. I want to know your work history, and I want to know your relevant skills as related to that particular role. You want it to be professional. You want to make sure that there's no misspellings, formatting, like those little things shouldn't matter, but they do. I talk to a lot of hiring managers who get hung up on little typos, and I'm like, get over it. But they often don't. So again, really think about this as a crucial and important document, and take the time to ensure that's professional. And I know you have great resources on this call that can help you with that. Again, the license and certifications, if we require that, then make that super prominent. I don't want to have to search to page 5 of your resume to find out that you have the key license that I need for this job. I want to know right away that you hit the mark, so I can then take a closer look at everything you have. And then small things too, like contact information, make sure you have a cell phone number, make sure you have a professional email address. Those little things make a big difference in terms of the impression that you make. So here's a sample resume. This used to be somebody's real resume, and then we made it more anonymous, so you don't know who it is. It's not me. But again, it's really straightforward. I think that the font's a little small, and maybe make it a little bit easier to read as I get older. I appreciate that. But the first thing I see there is contact information, education. I know what they're going to school for. And then relevant employee experience. So I want to call this out too. We have a lot of people who apply for a healthcare job, and maybe it was like 2 jobs ago. So 2 jobs ago, they were a medical assistant, and then they decided to go do something else for a while, and now they're applying to be a medical assistant again. So there's a couple ways you can address that. One way to do it is to highlight your relevant employee experience at the top. So again, right away, I know you've done the job, even if from a chronological standpoint, you did that job 2 jobs ago. So if the most recent thing that you're doing is the thing you're applying for, no problem. Just list it from 2021 back as far as you feel a need to go. But there are some small things that you can do to move information around to, again, make it really easy for the recruiter to know that you should go right into that yes pile for further consideration. The other piece that I want to share, and this is advice that's specific to us, I can't really speak for other healthcare organizations, but we're not really the type to get hung up on how long your resume is. So if your resume needs to be 2 pages, even 3 pages to get across the breadth of your experience, and also capture your leadership experience and your diversity experience and your volunteer experience, I would rather see that full picture than have you sell yourself short or not include some key information in your work history that's not going to make you then qualified for that job. So you may hear different things from different people, but at least from our perspective, I'd rather have the 3 pages, be able to go through it and understand you comprehensively than have you not do your best effort to stand out as a candidate because you felt compelled to make everything 5 fonts and, to the edge of the paper just to get it all on the 1 page. Okay, and again, I've alluded to a lot of this as well. So understanding that at public institutions, we very much screen to the job posting. So when you go look at some of those sample jobs, you'll see minimum and preferred qualifications. We literally put that into an Excel sheet, and that's what we screen against. I can say that because I designed the screening grid, so I can tell you exactly what we do for the university. So take the time. If you meet the qualification, you don't have to cut and paste it verbatim, but make it very clear that you hit the mark for those minimum qualifications. Preferred is great too, but anybody who meets the minimum qualifications can be hired for a job. So don't be dissuaded if you don't meet the preferred as well. Just make sure that you feel comfortable saying that I can do the minimum things required as outlined on this job posting. And then that last piece is just understanding that we do get a lot of applications. The hardest part about working for UC Davis Health is just getting that foot in the door. Once folks work here, they stay here. I mean, we do a lot to incentivize longevity, whether it's through like your pension or your raises. But to Ali's point earlier, we do a lot to invest in our staff. So we do a lot of professional development, certifications, money to go to conferences. So we want people to join us and we want them to stay and to get promotions. But you got to get that foot in the door. So it does require effort and work to stand out to get that initial job. And that's going to be the case anywhere. And in particular in healthcare, it's a very competitive field. But certainly you all are on the right path coming to workshops like this and getting a degree from a place like University of the Pacific.
All right. So I think I'm going to jump in now and go over some information regarding LinkedIn. So LinkedIn is a really great resource for individuals looking into their career opportunities for the future, because that is where all of the networking happens, right? It's a great tool to really get out there, get connected with individuals that are a part of the field you're interested in. And so if you're not on LinkedIn as of yet, it's a great opportunity for you to create a profile. It is pretty similar to, other social media sites, but the difference is the opportunity there to connect with individuals and network for potential career opportunities in the future. So just some general advice for your LinkedIn profile is that you should have a profile photo that is professional and approachable, a headline that can be searchable and that kind of correlates to the brand you're trying to create for yourself. So if you're interested in, healthcare and that's what you're currently going to school for, and having a headline that correlates to that. There is also an opportunity for you on LinkedIn to let recruiters know that you're open to new opportunities. And further along in that, in your about section, you want to also make sure that you're adding specialties and inserting keywords that pertain to your experience, your fields of interest, things that are kind of like hotspots that you might see on job postings that correlate to what you're interested in. So again, as Lyndon had mentioned, going into the job postings that are currently available and really taking a close look at what those postings look like, and looking at the types of qualifications that are regularly on there is going to really help you build out your about section, because it's going to help you kind of figure out what you need to succeed and find a position that correlates. Keywords, again, utilizing keywords is how recruiters oftentimes look for and source candidates on LinkedIn, is by searching keywords on LinkedIn Recruiter. And we have a whole kind of LinkedIn specific job talk that is available on our website, so we can get into more detail if interested. But also understanding the experience that you post on LinkedIn should kind of correlate to your resume. It doesn't have to be word for word a direct, verbatim posting of your resume on your experience section of LinkedIn, but we should be able to kind of see that this is the same person. If we look at your resume and then look at your LinkedIn profile, there should be kind of a correlation there. So just keeping that in mind. Also, skills, endorsements, and recommendations on LinkedIn are a really great tool for you to utilize as you build your network out, and as you kind of connect with other individuals who know that you have a specific skill set. Having them endorse you and then having you endorse them is going to be really great, because it'll help boost up your LinkedIn profile and build your network even more.
Yeah, and I just want one small piece. So just a little thing, but like any other social media network, there can be some downsides to this as well. So even something like your posting activity or the things that you like. So as you become part of a network, if you like something and I'm connected to you, it may pop up and say, Ali Martinez liked this posting, and the posting is, UC Davis is the worst. Like those things will kind of pop up on that social media network as well. So really do treat it in the same way you would treat your resume, as a professional tool and for professional networking. LinkedIn, there's a whole narrative on LinkedIn now about how it's becoming like Facebook, for lack of a better term, where people are posting political things and commentary, and that's fine. But the whole network, like all social media, is about visibility and about showing what people you're connected with are doing. So just be conscientious about that as you're building your brand, to Ali's point, that you're engaging with content that is reflective of who you are and who you want to be as a professional.
Exactly. So this is one of our lovely senior talent acquisition partners' LinkedIn profiles that she graciously shared so that we can utilize it as an example. So here we can see that Ellen has her name and a great profile picture that's friendly, approachable, and professional. We have her kind of keywords in the headline of her specialties, right? So the keywords and branding is regarding her experience, not necessarily to a specific job title or employer. So, her focus, HR, talent acquisition, recruiting, diversity services, all of those kind of those functions and skills that she wants to highlight as a part of her profession. Also, taking note of all the skills and endorsements that she has. These are connections that she's made throughout her professional experience that have then validated her skill set in healthcare, in recruiting, and in human resources. So there's kind of validation of the branding that she's created for herself. Also taking notice in the
those two galvanized grates that you over here. Yeah, they just came in. Yeah, for those empty over there.
Okay, there you go.
So in the About section of Ellen's profile, you can see that she's chosen to kind of give a quick snapshot of her experience. So 18 years of experience in the development and delivery of HR employment, recruiting, job search, and career development. And then there is kind of quantifiable experience here as well. So delivered more than 200 presentations to upwards of 10,000 professionals. Those are, that's really great to include in your About section because it kind of showcases the quantifiable experience that you have. And then below that, the specialties that she has that she wants to highlight for keyword searches that might pop up. So when other recruiters may be sourcing for someone with career advice and job search strategy skills, career assessment and career decoder, interview preparation. All of these kind of keywords have been carefully crafted to be searchable and for Ellen to pop up when those searches are done on LinkedIn. And then again, kind of those skills and endorsements demonstrates that others validate your experience and your expertise in all of these fields. So just, a quick snapshot, very, very high level overview of LinkedIn and how it can kind of serve as a benefit to your career search, because it really is a great networking tool, to Lyndon's point, when it's used in that capacity and not as an alternative to Facebook.
An enhancement of Facebook, right?
Yeah, there you go.
And I just wanted to also call out too, is that LinkedIn, around COVID, released that new initiative where you can do the open to work piece. And that's actually been really neat. We won't tell you all the secrets about what it looks like to do recruiting on the back end, but there's a really powerful algorithm that LinkedIn utilizes to make it easy for recruiters to find top candidates and the right candidates for these roles. And Ali alluded to a lot of the strategy around that, keywords, professional certifications, education, all of that. But that open to work piece is actually a really neat additional tool. As a recruiter, like those are going to be the people I'm going to start with. I want to look for people that are actively job seeking. And if you are indicating that you're open to work and you meet all of my other qualifications, you're probably going to be the first person I'm going to reach out to, because half the battle is already done. You're looking for a new job. Now, I'm also going to reach out to people that are passive job seekers, but that open to work piece is another powerful tool that you can take advantage of when you are looking for opportunities to pop up right away as a top candidate.
Awesome. All right. And with that, I think we that kind of concludes our formal presentation, but we really wanted to open it up and have a discussion with you all if you have any questions about opportunities that are at UC Davis or UC Davis Health, and answer any questions you might have. So feel free to unmute yourselves or enter any questions into the chat box. We're here and happy to answer what we can.
Great. And while we're waiting for questions, if you want to go to the next slide as well, Ali, that has our contact information for anybody who's interested.
Yeah, we'll be sure to share all of this, the slides with Alyssa after the presentation today, so that they can be distributed to you all, and you'll have all of the links that we provided on each slide as well as our email and LinkedIn profile, should you wish to connect.
All right, so let us know if there's any questions out there. This is your opportunity for one-to-one executive recruiter advice.
I have a question.
Yeah.
This is for Landon. You said you went to UOP. What was your study as an undergraduate?
Yeah, so I actually went to UC Davis for undergrad. So I was a chemical engineer for a year, and then I met some chemical engineers and decided that was not the life for me. So I pivoted to psychology is where I landed. And I also got a minor in education and human development. And it was actually in my senior year of college that I learned about, so this is a long journey to get to where I'm at now. I'll give you the short version. I learned about student services and student affairs, actually, And so that's what I went to UOP for. I got my master's in educational administration with a specialization in student affairs. And my professional background has primarily been in student affairs, working with, in particular, underrepresented student communities, working with student organizations, a lot of mentorship and advising and that type of work. And then a couple years ago, I decided that I wanted to go in a different direction and work on staff recruitment initiatives with a specific focus on diversity, with this understanding that, by having more diverse staff at UC Davis and UC Davis Health, that would be an opportunity for me to even more impact the diverse students that were coming to our school and the diverse patients that we serve. And so it was a chance to do this work a little bit differently, but still have this focus on diversity, equity, and inclusion. And then I actually got my doctoral degree from UC Davis as well in educational leadership. So very much a UC Davis and UOP guy. And then Allie, I know, went to Sac State. So you've got a good reflection of the region here on this call.
Mm-hmm. It looks like I had another question come in through direct message that asks, does UC Davis have any summer internships or programs for specifically pre-med undergraduate students?
Yeah, probably.
Yeah, that's a great question. And the answer is there probably is. We're probably not the most well-suited individuals to answer that question with detail, but we can certainly look into those resources and find a more detailed answer for you as to how those opportunities come to fruition.
Yeah, send us an email. We have a network of folks that we can connect you with.
Mm-hmm. Any other questions?
Okay, not hearing any, then I think we're good. We appreciated the opportunity to come and present to you all. Again, our hope is that this is helpful. It's just scratching the surface, but we really wanted to highlight the pieces that we think are, most relevant to all of you as you're thinking about your future career goals. And again, I just want to highlight that you have great, collaborators and partners that are on this call that are happy to help you out. Lisa, Theta, Monica, others. Here to support you all in this journey too. So they have our contact information. We're not scary people. We're happy to connect and do what we can to support you on your journey.
Mm-hmm. Thank you all for having us today. And like I said, we'll be sharing the slides, so they'll all be distributed to all of you. Thank you.
Awesome. Thank you all so much. And we were recording this, so we'll share recording, Lyndon and Allie, with you both, as well as to the students. So thank you all attending. And for our students as well, Dita Estrada, if you have not met her yet, in our career services office, is our pre-health advisor. So if you haven't talked with her yet about your interest in a profession in healthcare, be sure to reach out to her. You can find her on Handshake to make an appointment. So again, thank you all so much and have a great rest of your days.
Yeah, go Tigers.
Awesome. Thanks, everyone.